Okay, it gives me great pleasure to introduce to all of you Dr. Russell Jaffe.
Well, thank you. And it is a pleasure to meet and greet each of you to discuss the difference between cause and consequence, to discuss why nature, nurture, and wholeness are guiding principles that I did not learn in internal medicine nor at the Clinical Center of NIH. But we now know that autoimmunity means self-attack and inflammation means repair deficit. And you want to be tolerant. You want to survive this 21st century where we are, shall I say, marinating in a host of anti-nutrient chemicals. Yes, thank you for that. So I'm a cross-trained physician. I did my MD PhD at Boston University. I was the education director to establish the Certified Clinical Nutrition Profession as health coaches. I maintain a fellow status in a half a dozen different organizations. I'm a founding fellow of the Health Studies Collegium. I founded PERC Integrative Health that includes the PIH Academy for certification, which we invite you all to join, and ELISA Act Biotechnologies and RMJHRX. And from this, I think you can conclude that either I'm easily bored or I have a Jewish mother, and it turns out to be both. So when we look at functional immunology today, our immune system gives amplified responses to foreign invaders. And one rethinking that I will offer to you is that what we call inflammation is a term in pathology, but it's really repair deficit in physiology. And it has to do with, do you have too much of the toxin or immunotoxin loads, too much of the bad stuff, or not enough of the good stuff? And then we're going to talk about delayed allergies, because immediate allergies, you can pretty well tell. You get stung by the bee, you get hives, wheezes, or anaphylactic reactions, and it's probably the bee. But delayed allergies require cell culture. They benefit from an ex vivo high sensitivity lymphocyte response assay that we pioneered in the early 80s, 1980s. We have over 80,000 cases in our database. We have 25 million cell cultures under our belt. And the essence of what I'm going to say is that it's a lot about what you eat and drink, think and do. Because if you want personalized lifestyle repair, which I do, and I do my best to practice at least as much as I preach, so that proactive primary prevention in practice becomes the new normal. And when we're healthy, our immune defense and repair system can defend us in essence, during the day, repair us at night, and stay in balance, which includes deleting, notice the defend, repair, and delete, deleting the abnormal cells that we all make every day. We'll talk about that in a few more minutes, and we will get to COVID-19, and I hope have time for questions. So the innate immune system and our mucosal defenses are our primary facts of resilience. And yes, there are many microbiomes, as you see on the right, on the skin, in the nose, in the mouth, in the lungs, in the GI tract, in the ear, name a part of the body, it has its own rather distinctive microbiome to eliminate foreign invaders before they get in. So when our innate immune defense and repair system is working, if heaven forfend something gets through the defensins and the opsins, the secretory Ig and the mucins that are on the surface, if it gets through that, one of those wiggly dendritic cells, a granulocyte, a fibroblast, puts it into the lysosomal recycling center, breaks it down to elemental building blocks. No immune response, no harm, no foul, but the building blocks are then exported so the body can make use of them. Most of the time, though, when we talk about the immune system, it's after the innate system has been exhausted, overstimulated and exhausted, and then you call in the adaptive immune defense and repair system. But to say the same thing in a slightly different way, a healthy immune defense and repair system, there are no allergies and you're tolerant. You neutralize infections and allergens before calling on the T or B cells for the adaptive responses. And if you notice on the bottom of the slide, there are 50 billion of these dendritic white cells, each that, when they're healthy and have enough antioxidants and enough magnesium and buffering minerals, they can recycle 50 pathogens per cell. 50 times 50 is 2.5 billion. Foreign invaders could get in if you had healthy dendritic cells and they'd recycle them. The test is called phagocytic index. It's an old-fashioned test, not very expensive. Good quality clinical labs can do phagocytic index and measure, can those white cells from that person take up 50 or more? It's usually Serratia organisms, but benign organisms. Too many people have run out of antioxidants and are depleted in buffering minerals and other essentials, and therefore their phagocytic index might be 1 or 2 rather than 50. As Mel Brooks, the 2,000-year-old man, used to say, don't do that. So this immune defense and repair system has 2 parts. On the left part of the slide, you see innate. You're born with this to repair and defend you. This has to do with granulocytes and basophils and eosinophils and mast cells and macrophages and fibroblasts and on. And then the adaptive, if needed, the amplified defense, which more or less comes in 2 big categories, B cells and T cells. Now the B cells use antibody and they can produce good or bad, helpful or harmful antibodies. If you just do a physical chemistry test for, say, IgG or IgA or IgM antibodies, that's physical chemistry. You can't tell if it's good or bad, helpful or harmful. And then it turns out the T cells that don't use antibodies are as or more important than the B cells. So you really need a cell culture. You really need to interrogate ex vivo the reactive adaptive immune system to see if it's been called to attention and if it's needed. Saying the same thing in a slightly different way, and I know we're reviewing, but I hope it's a helpful review. The adaptive immune system has 2 sides, natural, which we recommend, and artificial, which we don't recommend. The natural is on the top. This is passive maternal protection for the first year or so after birth, and active protection from infection that leaves you with protective, helpful, neutralizing antibodies for life. And then there's artificial, which is passive, like IVIG, or active immunization, and that really is a different way of evoking immune responses. So best case, as you see on the bottom of the slide, you attack invaders that get in, and then you come back and boost the elective protective secretory IgA and mucins and other mucosal opsonins and defensins that are on the skin and from the mouth to the tush. When they're operative, you're resistant and resilient. You might see the foreign invader. You might even make a protective response, but you won't get sick. Now, inflammation is really repair deficit. And when you remove the repair blocks, you find out that whether we're talking about autoimmune arthritis and diabetes or cardiovascular disease or cancer, pulmonary diseases, neurologic diseases like Alzheimer's and prions. And as if we didn't have enough else to worry about, there are these prions, which are self-replicating proteins. But they gave Stanley Prusner the Nobel Prize for figuring that out, and he deserved it. And Giuseppe Legname, his long-term student, is a colleague and friend of mine. And I asked him, how did you put up with Stan? Because Stan has a very, shall I say, strong personality. And Giuseppe just shrugged and said, I'm Italian. We get along with everyone. But getting back to this presentation, hidden immune burdens are delayed hypersensitivities and allergies that are hard to find because the reactions occur 3 hours to 3 weeks after exposure. So now, even if you have a perfect diet diary, even if you have a perfect history, if it's been 3 weeks since the exposure, how is that going to help you look through the cloud and see what needs to be seen? Symptoms are often nonspecific. Think of Schwartzman reactions, think of Arthus reactions, think of serum sickness reactions. These are very important and generally overlooked in most conventional therapy, care, clinics. These are the reactors that drain vitality. You get unwell. You're part of the walking wounded. Your get up and go, got up and went, and we can't find it anymore. So when we started, the immune defense and repair system of human beings was considered to be a black box. We pioneered this ex vivo procedure that measures concurrently in mixed cell culture type 2, 3, and 4. We pick up the harmful antibodies, not the helpful ones. We pick up the immune complexes, the type 3 reactions that cause vasculitis and glomerulonephritis. And we pick up the type 4 T cell non-antibody mediated reactions. So history and serology are not helpful for the delayed immune burdens that often predispose to inflammatory repair deficient conditions that predispose towards autoimmune self-attacking conditions. Because it's 3 hours to 3 weeks from exposure to symptoms for the type 2, 3, and 4 delayed immune reactions. So we have pioneered and recommend the ex vivo lymphocyte response assays. We published a few years ago high sensitivity lymphocyte response assays with less than 3% variance on over 4,000 consecutive blind split samples reported at the American Society for Integrative Pathology. Now, there are in vitro tests. They're all fatally flawed from our point of view because they're not functional and they don't give you a complete picture. So looking through a glass darkly, we don't recommend. Looking clearly through the lens of this ex vivo lymphocyte response assay, we do recommend. And here you see Jamie, a technician, senior technician, looking through a microscope and comparing results that another technician received. So we directly observe the response of these living white blood cells called lymphocytes, and whether they're B or T class, we pick them up. We look at all 3 delayed pathways. We have a method with very few false positives from the clinical feedback we've gotten and the community-based outcome studies that I'll review in a few minutes. And intolerances, which exist separate from immune reactions due to a weak digestion and or environmental toxins, can then be more easily detected and mitigated. On the left side of this slide, you see non-reactive lymphocytes. On the right side, you see reactive lymphocytes. I really only include this slide because some people will say to you, it's really hard to tell the difference between reactive and non-reactive lymphocytes. It may be for them, but it's easy for us. And I hope you can see the difference because on the right, there are reactive lymphocytes. They have, quote, lit up. And on the left, it looks kind of like, you know, Starry Night. So if you do the procedure accurately, you look at the lymphocytes. Not at everything at a certain size, not looking through a glass darkly at indirect release of something or other that may or may not be relevant, but actually at the reactive T and B class lymphocytes. That's why it's an ex vivo lymphocyte response assay, ex vivo LRA. Now, on an ounce of blood, we can do up to 500 cell cultures, although not everybody needs everything. We do have the ability to standardize and calibrate each of the items we test for. We have the largest number of foods, additives, and preservatives. We have the largest number of environmental chemicals, 60. Toxic minerals, 14. Medications, molds, danders, hair, feathers, and herbs, because they can all contribute either to well-being, which is the goal, or to immune defense and repair burdens, which is the opposite of the goal. So what do we recommend? Do the ex vivo LRA test, substitute for reactive substances, 6 months for strong reactions, at least 3 months for moderate reactions, and then more importantly, have a lifestyle program that corrects nutritional deficiencies that reduce defense and repair abilities, that initiate detoxification mechanisms to get the bad stuff out in safer ways, and to alkalinize. Because, as Sherry Rogers titled one of her many fine books, alkalinize or die. Now, you want to enhance human healing responses by alkalinizing the cells so that they can withstand the foreign invaders and the toxins so that they can defend and repair you. And many years ago in the early 80s, we standardized a health appraisal questionnaire. That health appraisal or health assessment questionnaire allows us to guide supplements, activity, and environmental recommendations, and if you want a rotation diet option. So alkalinization, based on what you eat and drink, what you think and do, is a way to survive and thrive in the 21st century. So it is a very personalized report. It is individualized. It is primary proactive attention to evoking human healing responses. And over the years, we have synthesized new information to show that this approach has added value, saves lives and treasure. And I know that colleagues of mine say, if you save someone's life, they'll just spend more money and that'll break the bank. I don't find that to be true. When you help someone with epigenetics, when you help someone with what they eat and drink, think and do, they end up spending less and feeling better. Now, we've done a number of community-based outcome studies. The goal was to restore tolerance and reset hypersensitivity, as you see in the upper left. Study subjects were carefully selected to be at best standard of conventional care, and then they were recruited based on willingness and ability to comply, as you see in the lower right. And we've done a number of these community-based outcome studies over the years. The first one that we published was a novel treatment for fibromyalgia muscle pain that improves clinical outcomes. And in just 6 months of best efforts in the community, people had 50% less pain, 70% less depression, 50% more energy, 30% less stiffness. And there is a consumer-friendly book called Fibromyalgia, My Journey to Wellness by Claire, C-L-A-I-R-E, Claire Musickant, M-U-S-I-C-K-A-N-T. Fibromyalgia, My Journey to Wellness, based on this study, because she was the one who wouldn't let me go until we did this study. Now you see some of the data that we published from the study. And before, all the data was normalized, so they're all at 100%. At the midpoint, all 3 groups look better, but by 6 months, the control placebo group had fallen back. Primary fibromyalgia continued to improve, and secondary, which is complicated fibromyalgia, was improving even faster. And my colleague, Patricia Doister, and I published this in the Journal of Musculoskeletal Pain back probably 15 years ago. And we've done follow-up with these people. They continue to feel and function better. They continue to follow these lifestyle epigenetic programs, and they spend less, but live well. What about the classic autoimmune conditions, like type 1 diabetes, like type 2 diabetes? Well, starting from best standard of care, we were able to achieve a full 1% decrease in hemoglobin A1C in both type 2 and separately in type 1 diabetics, which means we added 20 plus years of quality life by reducing their hemoglobin A1C by more than 1%. And particularly significant is that the type 2 diabetics had an 18% reduction in insulin, which means insulin resistance was improving. It wasn't back to perfect, but those that we have anecdotally followed have continued to get back to a hemoglobin A1C of less than 5, which is way better than most of the hemoglobin A1Cs that I see in practice. And I don't have a primary practice, but I do review and consult with colleagues like yourselves. So what did we find? We found that sweeteners were associated with both type 1 and type 2 diabetes, that toxic minerals were particularly prevalent in the type 1 diabetics, that environmental chemicals were afflicting both type 1 and type 2, additives more type 1 than type 2, and cow dairy more type 2 than type 1. Now, these are results of a outcome study that we published in Diabetic Medicine, showing that the immune defense and repair system, especially the delayed part that's so hard to get by history, is really important. Why? Because if you see the upper left, in most people, half to 3/4 of their immune defense and repair system lines the intestines on what are called Peyer's patches. And I'm old enough to remember when we were taught that Peyer's patches were vestigial, which means we don't know what they do, so they're just carried along. It turns out they're really important, and a big fraction of the immune defense and repair system is in the intestinal nervous system, in constant communion and conversation with the vagus, through the vagus channel, the vagus pathway, with the central nervous system. And with repair deficit or inflammation, the surface area of the intestines reduces. And you get what we would clinically call leaky gut. A healthy person, a person whose biopsy you would see in the upper left, the surface area of their small and large intestine would fill a tennis court if you laid it out flat. How about someone on the right, that damaged intestinal lining that you see on the right? They would barely fill the surface area on 1/4 or less of the court. So it turns out the body is very elegantly reprieved. It is very elegantly designed to have maximum surface area in the shortest or smallest volume. And when you're good to it, it's good back to you. And when you're not, it's really a problem. So if you're concerned about hospitality to yeast and fungi, if you're concerned about hospitality to parasites and harmful pathogenic bacteria or environmental toxins, well, think about undigested food remnants that are burdening the immune defense and repair system and pushing people into immune exhaustion, repair deficit, and inflammatory autoimmune conditions. Dr. Dennis Burkitt taught me that we need prebiotic fibers, probiotic bugs, and symbiotics, and we do. And he taught for prebiotic fibers, 40 to 100 grams. That's at the top of the slide. In the middle, it says prebiotic bugs, 40 to 100 billion colony-forming units, live organisms, multi-strain, dairy-free. And then symbiotics, recycled glutamine. Glutamine is the energy source for your enterocytes. Glutamine is the energy source for the lining cells of your intestine. And taking 1.5 to 6 grams, say 1.5 grams on rising, 1.5 grams before bed, maybe another dose or two before exercise or eating, and you can raise the energy of repair in your intestines without imbalancing the glutamine to glutamate, the glutamine to asparagine relationships. So I know that there are colleagues like Doug Wilmot who has published elegant studies showing that very high doses of glutamine can repair the gut, but other studies have shown that the glutamine asparagine imbalance, that the glutamine to glutamate problem is a big problem as an excitoneuratoxin. So we have recycled the glutamine using PAC, pyridoxal alpha-ketoglutarate. We have lots of information about this being a safer and more effective way so that you can combine prebiotics, probiotics, and symbiotics and restore people who have maldigestion, dysbiosis, problems post-antibiotics, post-hormones and or medical therapies that set them up for these kinds of problems that make for very expensive long-term suffering. Now, the digestive microbiome has to do with conversion of food into energy. And what you can digest, assimilate, utilize, and eliminate without immune burden is what we want you to follow. And that very often means doing the LRA test to find out the individual delayed reactions, and then having a digestible, easy to assimilate, utilize, and eliminate diet. What about intestinal transit time? We know that the healthy intestinal transit time is 12 to 18 hours. We know that typical Americans today have 72 to 144 hours. That's 3 days to a week. So there are people who will tell you they're regular, and my response is, please do this GI transit time measurement. Please check your digestive transit time using activated charcoal. Because what came out today might have come in last week. It should have come in last night. How about some case histories? Here's a case that you would think was type 1 because it's rashes and hives. It's a 58-year-old woman. She has blisters on her hands, itching, throat closing, brain fog. This sounds like immediate reactions, histaminic amplified reactions. The LRA test was done, and she reacted to cow dairy, potato, sulfite, metabisulfite, food colorings, and organophosphates. That's an interesting set out of hundreds and hundreds of cell cultures that were done. After 2 weeks of substitution and avoidance, the rash reduced, blisters were gone, the skin was much improved. Another case, 50-year-old woman diagnosed with attention deficit hyperactivity disorder. She had lack of restorative sleep. She had decreased energy and weight gain that she couldn't manage well, mild alopecia. She had been treated with Adderall without much benefit. The LRA tests were done, and she reacted to glutens, which are common to all grains, titanium dioxide, sulfite, metabisulfite, and salicylates. She substituted for those reactions. She had a personalized supplementation plan that included multivitamins, sufficient B-complex multivitamins to keep her urine sunshine yellow, repair polyphenolics, bone-building nutrients, and adrenal support formula with an alkalinizing diet and lifestyle. In about a month, she achieved appetite control. It took about 2 months to get sleep rhythms to return to normal and get restorative sleep. 3 months, no loss of hair, night tremors gone, prescriptions reduced by half. 4 months, energy level high, sleeping well, focus improved. So it takes months to repair from years or decades of slipping down the epigenetic slope. Now about Hashimoto's thyroiditis. First case is a 30-year-old woman with 7 years of symptoms before the thyroiditis was properly diagnosed. That's very common. This included fatigue, muscle weakness, joint pain, weight gain, bloating, and digestive distress. She had been treated with Synthroid and Euthyrox, it's a European compound, without benefit. Out of 375 cell cultures that were done, she reacted to 20 items, including the nightshade family, trichophyton, which is a fungus, benzaldehyde, and methylene chloride. Substitution for these reactive items, along with personal nutrients and an alkalinizing lifestyle, were implemented by the clinician. And initially, the energy level dramatically increased. That was in a matter of weeks. Pain was reduced. Thyroid medicines were reduced. The person said, "This is the best I felt in years." And the clinician who submitted this case said that's why she stays in practice. Another case of thyroiditis, 36-year-old woman, 5 pregnancies, 3 children. She has low energy, 18 kilograms of extra weight, little joy in life, morning temperature often below 98, which is a pathognomonic according to Broda Barnes for hypothyroidism. Her total T3 and T4 were within lab test ranges, but her free T3 was low. Her free T3 was low. Her free T4 was okay. Her TSH was elevated. Her 2-hour glucose and insulin were elevated. Her free cortisol was up and her DHEA was down. If inflammation is really repair deficit, as an expression of it, the thyroid gland is attacked because of tissue permeability. The blood-thyroid barrier is not being repaired. That leads to a loss of thyroid functioning and what we call autoimmune thyroiditis. In this case, the person reacted to cow dairy, MSG, arsenic, sulfite, chloroform, and a detoxification substitution program was implemented that included initially 2 grains of desiccated thyroid if the morning temperature was below 98, green dichromatic lights to stimulate visual to pineal rhythm, and salt and soda baths to reduce stress after the day and before bed. After 6 months, the person was asymptomatic, had lost 10 kilograms of weight, had discontinued thyroid hormones, free cortisol and DHEA, glucose and insulin were now all healthy and normal. Here's a person from Virginia who says, "I've not had any migraines since I started the LRA program after having them for 20 years. It's great to be free of them." Bob Egger in Germany showed years ago that 85% to more of all migraines are triggered by digestive remnants that become excitoneurotoxins in the gut and central nervous systems. Here's someone from Massachusetts who said that they were amazed at their fast recovery from a 4-year struggle with chronic fatigue syndrome, chronic fatigue immune dysfunction syndrome, and depression once they started this LRA program. They've returned to work, energy level and health are stronger than before I got sick. Never thought I could feel this healthy again. Here's a case of allergic rhinitis. In this case, it's a 58-year-old Hispanic woman who since childhood has had, whatever goes around, she catches, constant sneezing, stuffy runny nose, itchy throat, immediate allergens to dust, pollen, and grasses. You would think that this is type 1 reactions, but perhaps they are really spillover from repair deficit in people who have been symptomatically treated with antihistamines and decongestants to the point where they become dependent on the antihistamines and decongestants because of what's called rebound phenomena. Here's a case of CFIDS, chronic fatigue and immune dysfunction. I think I showed this already, so I'm going to move on to the next slide. Oh, maybe I pushed that back. Okay, so here's the case of allergic rhinitis. Stay with me. Here's the case of allergic rhinitis. 11 reactions out of about 380 cell cultures done, including pyrene and cloves. You'd be surprised where cloves get in. Propylene glycol, candida, and saccharin. The recommendation was to reduce the immune burden by substituting for the truly reactive items, strong for 6 months, moderate for at least 3 months, and follow this alkalinizing epigenetic lifestyle program. Using the health appraisal questionnaire and the cell culture, a personalized program was designed that included attitude and mindfulness practices like abdominal breathing and active meditation, personalized supplementation to address deficits that had accumulated over years. In this case, including buffered L ascorbate, polyphenolics, specifically quercetin and dihydrate and soluble OPC, multi-strain probiotics, magnesium and choline citrate, based on the morning urine after rest, because after 6 or more hours of rest, the urine pH should be 6.5 to 7.5, and then you only need 440 milligrams of elemental magnesium in addition to your diet. And for every half a pH unit below 6.5, you need another dose of 220 milligrams of elemental magnesium plus a teaspoon of choline citrate to enhance uptake and chaperone delivery to the cells that are hungry for the magnesium. Outcome, post-nasal drip dramatically reduced because of better repair, restorative sleep, more restful sleep, and no heavy head in the morning. That's a desirable outcome. 5 months later, describe themselves as a different person, no fatigue, and seasonal allergies have gone. So systematic substitution, alkalinization, and optimized nutritional supplementation, in this case, achieved a very desirable outcome after too many years of suffering and affliction. Here's another case, a 31-year-old woman diagnosed with ulcerative colitis. She did an over-the-counter cleanse that triggered bloody stools. We don't recommend that. Past medical history included a large polyp removed from her small intestine as an infant, and her mother has a history of irritable bowel syndrome. Initially, she was treated with Lialda without much benefit. She had 18 reactions out of about 378 cell cultures that were done, but it included corn, black tea, olives, xanthan gum, orange, ginger, pinene, and food dyes. And the plan was to substitute, inform her where she would have hidden sources of these reactors that burden her immune system, provide supplements based on the health appraisal questionnaire, in this case including a super multivitamin multimineral, essential omega-3, 6, and 9 essential fats, bone building nutrients because of a history of osteopenia and osteoporosis, recycled glutamine with PAC to restore that probiotic boost, and a blood building complex based on ferrous aspartate, the safer form of the safer iron that we recommend. Hydroxycobalamin, nature's B12, and polyphenolics were included because very often people need nature's B12, not pharmaceutical B12, but nature's B12, and these safer polyphenolics, including quercetin, dihydrate, and soluble OPC, to help jumpstart their repair. Took 1.5 years, and that meant 3 6-month cycles. Now her CBC has normalized. Her C-reactive protein is down to 1.14, and we want it less than 0.5, but this is good progress. Her ferritin is down to 14. That inducible protein was very high before. Still on Asacol, but reducing slowly. Weight is back up to 132 pounds after being, quote, anorexic. Person is still amenorrheic, but breast tissue is coming back, gets acupuncture once a month. The family is healthier. The husband lost weight. Kids are eating healthier too. Follow up, another 6 months of improvement. Here's a 52-year-old black fellow who comes for chiropractic care because of neck pain and stiffness and intermittent bilateral fingertip paresthesias, fatigue, ability, poor sleep, and being tender everywhere. His routine labs showed an elevated cholesterol and triglycerides, an elevated glucose, and a low vitamin D. Sounds like a fairly typical American. The alkalinizing plan was to avoid sugar. You're sweet enough as you are. You don't need to add sugar to your diet. Empty calorie sugar is an anti-nutrient, not an option in the 21st century. And then remove dairy because of the sensitivity and its relationship to diabetes. Graze through the day because of weak digestion, so eat more frequently. Have a hard-boiled egg as a snack. Make a smoothie. Try Ezekiel bread with almond butter or a nut butter you make at home. Native whey protein turns out to be immune helpful, as do vegetables, nuts, seeds, and sprouts. And then he found that he could sleep 7 to 9 hours and repair himself, get restorative sleep. And he reduced dramatically his alcohol intake. So in this specific situation, it had to do with a comprehensive multivitamin, multimineral to keep the urine sunshine yellow, vitamin D sufficient to bring the person into the 50 to 80 nanogram range. That was monitored, including an ionized calcium after 2 weeks because of his thiazide prescription. There is a relative contraindication to warfarin. We can talk to you about anticoagulants and how to avoid the problems. And the goal was better glucose control, decreased musculoskeletal pain, better energy levels. This included magnesium and choline citrate along with vitamin D. And following this approach that included a multi-part glucose regulation micellized soft gel that includes chlorosolic acid and French lilac and bitter melon, known in the Bible as mara, chromium and vanadium, but in safer biological forms, 1 or 2 with each meal based on blood sugar. Now, the chromium deficiency is associated with severe insulin resistance, hyperglycemia, hypertriglyceridemia, and painful neuropathy. So just by correcting the chromium, vanadium, and glucose regulation opportunities, many benefits were found. Now, omega-3 fats, specifically 3 a day of EPA and DHA in micellized soft gels, then B6, B12, and folate to dissolve under the tongue before swallowing, 3 per day, basically 1 with each meal, to reduce homocysteine levels and improve methylation. His wife comes to the appointments. It's a family affair. After 1 week on supplements and the diet, sleeping better, increased energy, eating more frequently and healthier. And if you have any need for reinforcement or clarification, there has been a 15-fold, that is 1,500% increase between 1900 and 2000 in the environmental industrial chemicals to which we are exposed. And according to the National Academy of Sciences, if you look at all pregnant women in the United States, in their cord blood, you can find 43 or more of these persisting organic pollutants, solvent residues, and or xenotoxins.
Yes.
So yes, we really are marinating in a sea of these chemicals. Question? So the environmental burdens include overloading the liver. You see that at the top of this slide. Detoxification, impairments, oxidative stress, which means an antioxidant deficit, free radical production, which means an antioxidant deficit, problems with repair and comfort and pain, and then usually symptom suppressive therapies before we get to reversing and redressing the causes. So if you treat the symptoms and the causes, you get some benefits. If you look at the real underlying upstream fundamental causes and you correct the deficits, get enough of the good stuff in and the bad stuff out, then you can thrive in the 21st century. Now, healthy detoxification involves the liver, as you see in the upper left. It involves the stomach, as you see in the middle upper, the lungs, the intestines, the skin, which is more than a wrapper. It is the largest organ in your body, and it can be an accessory organ of excretion if your kidneys and liver and spleen are overloaded. So we're in favor of pro-repair detoxification and antioxidant sufficiency. You see in the upper left, what we recommend is nature's ascorbate taken based on your weekly C cleanse. In the upper middle, dark fruits. These are the super foods. This happens to be a pomegranate, but any of the dark fruits and whole foods are fine. In the upper right, B-methyl complex, sufficient to keep your urine sunshine yellow. In the lower left, ascorbates and green drinks freshly done for biodetoxification. In the lower middle, high sulfur foods, which we have coined the acronym GGOBE, garlic, ginger, onions, brassica sprouts, and eggs. And we agree with President Thomas Jefferson that these should be staples in your diet, not condiments. And then we recommend the alkalinizing acetylenes and the essential fats, EPA and DHA, because even if you're eating a better diet, you're still probably getting too much omega-6 and too little omega-3. And Artemis Simopoulos has taught us about the Greek Mediterranean diet, which is omega-3 rich. It's also rich in relationships and in walking and in other beneficial activities. But there are examples of healthy cultures and cuisines, including the Greek Mediterranean diet, the traditional Japanese diet, etc. A traditional Buddhist diet would qualify. So eat what you can digest, assimilate, and eliminate without immune burden. And we have published about this in a series of books edited by Watson, Preety, and Zibati. This one was about bioactive food as dietary interventions in cardiovascular disease. And when I was still at the NIH Clinical Center, part of my work was to study animal models of human heart disease. And we learned a lot about the importance of stress and toxins, the importance of essential nutrients, and of not just treating the symptoms, but getting to the cause. Now, one of the things we've recommended that I do want to mention briefly is an ascorbate calibration, or what we call the C cleanse. If you're a healthy person, you can do that with a half a teaspoon, which is 1.5 grams, every 15 minutes, and most people will cleanse within an hour. If you're moderately ill, you want twice that, 3 grams every 15 minutes in water, or the herbal beverage of your choice. And if you're chronically ill, start with 6 grams, 2 teaspoons every 15 minutes. That's 24 grams in an hour. Within an hour or two, that would be 48 grams. And most people will cleanse within that time. Here you see the results of self-reporting something like 4,300 people. And if I get it to something more visually easy to understand, the asymptomatic were in the yellow, and they cleansed on less than 4 grams. The orange were the minimally symptomatic people, where it took 5 to 15 grams. The green were the 80%, the average walking wounded, where it took between 15 and 100 plus grams. And then there were a few people out there who needed substantial amounts of ascorbate because of their anti-nutrient oxidative burden before they could cleanse. We have published over many years a chart of alkalinizing foods. If you're getting better, you want 80% of what you consume, 80% of what's on your plate to be on the right and alkalinizing. And yes, you can have 20% on the left when you're recovering. And once you're well, it's 60-40. You need an excess of alkaline forming foods, but it doesn't need to be 80% for recovery, 60% for maintenance.
Okay.
Now, in regard to alkalinizing, it has to do with foods and water, it has to do with activity and first AM urine measurement, it has to do with magnesium and choline citrate based on how much extra acid you're producing. It has to do with learning how to breathe again, abdominal breathing recommended, green dichromatic light or sunlight, forest bathing is recommended if you can find a forest to bathe in. Eating in harmony with your nature and lifestyle based on the LRA test, eating locally grown, vine-ripened, organic, or biodynamically derived as possible. My front yard is a permaculture biodynamic food forest, started by my son about 9 years ago. You're welcome to come and enjoy it. Make restorative sleep a priority, and we can help re-entrain the sleep rhythms, and work your muscles and relax in proportion. Very often I find people will exercise, but they don't stretch enough and they don't enjoy the relaxation response. Also, we find that most people who work out have a glutamine deficiency, and if you take the recycled glutamine, that is the glutamine with PAC, about half an hour before working out, your peak performance will go up and your recovery time will shorten. So we're almost done. Now, first morning urine pH is a measure of metabolic excess acid. If you have excess metabolic acid, the battery and mitochondria begin to shut down. Now, when you are alkaline, when you have enough magnesium and all the other good things like ascorbate, your efficiency of protein synthesis, as you see in the lower left, is more than 90%. But if you have metabolic acidosis, as a lot of people do as a comorbidity, that efficiency might drop to 10%, which means 90% doesn't pass and has to get recycled. And that is a terrible energetic burden on the body. So magnesium, the forgotten electrolyte, as Mildred Seelig used to call it, turns out to be very important. You don't want to be too acid. You do want to be in the green healthy zone. This is after 6 hours of rest. And if you're consistently alkaline, you might have catabolic illness, and we should consult. So metabolic acidosis wears you down, catabolic ammonia loss wears you down. In the middle, the Goldilocks scenario turns out to be true, alkalinized and energized with magnesium and choline citrate. So magnesium, at least 440, maybe as much as 880 milligrams a day. I currently take 1,320. Magnesium displaces toxic minerals, and it's an antioxidant that protects fats in transit, like the EFA and DHA. And choline converts to acetylcholine, cholinergic bile, does lots of good things in the body, and choline deficiency is endemic today. And citrate energizes and alkalinizes, remember Hans Krebs. So in regard to COVID-19, I told you we would get to COVID-19. I recommend to you two active URLs on the bottom of the slide. These are both in medium.com online. They are both by Amory Lovins and Dr. Eric Rasmussen. And one is, don't just avoid the virus, defeat it by strengthening your immunity. The other is a user's guide to vitamin C in regard to COVID-19. So if you follow our guidance about hydration and checking first morning urine pH and getting enough quality restorative sleep and digesting, assimilating, and eliminating without immune burden what you consume, if you have quality air, which is possible, then when you add the buffered ascorbate in nature's L form, the magnesium and choline citrate and zinc, and yes, if you've lost your sense of smell or taste recently, that's probably zinc deficiency in addition to the magnesium deficiency. Polyphenolics, specifically quercetin, dihydrate, and soluble OPC, vitamin D to bring you into the desirable range of 50 to 80, and for most of us that means drops under the tongue, and some kind of liver detox, phase 1, phase 2, phase 3, detoxification. So the next big thing from our point of view is global recognition that there's 1,000 to 1,000,000-fold increase in the toxin exposures, that they're oxidative and anti-nutrients, and that means we have less of the elective protective nutrients. So let's do the high sensitivity predictive biomarker test. 8 of them cover all of epigenetics, metabolomics, and microbiomics. And these are all cause morbidity mortality tests. They compare therapy outcomes, and they are therapeutic biofeedback markers if you interpret them to best outcome value. And they are hemoglobin A1C, that, as you see on the right side of the slide, should be less than 5%. High sensitivity C-reactive protein. On the far right, you see less than 0.5, which is the goal best outcome value that healthy people have. Homocysteine should be less than 6. hsLRA should have no delayed reactions because you're tolerant to the world. First morning urine pH in the 6.5 to 7.5 range, indicating enough magnesium and buffering minerals. Vitamin D in the 50 to 80 range to reduce the myriad consequences of low vitamin D. Omega-3 index of more than 8%, and 8-oxoguanine, that's probably the least familiar one, which is the measure of oxidative damage to your DNA, and it should be less than 5 nanograms per milligram of creatinine. That can be done on a spot urine. So as I started, I want to review with you what amplified responses to foreign invaders are like, whether they be infectious or not, that inflammation is really repair deficit because of the toxin and immunotoxin load of the 21st century, that delayed allergies require cell culture, the ex vivo high sensitivity lymphocyte response assay that tests to distinguish helpful from harmful defense reactions. Think of cytokine storm. And it is about what you eat and drink, think and do. So a personalized lifestyle repair program, a proactive primary prevention and practice plan is what we for the last 30 or 40 years have been guided to. I came as a skeptic, I did not come as a believer, but in summary, a healthy immune response defends and repairs you. And if you use these predictive high sensitivity assessment tools, you can guide individuals to a happier, healthier, less costly, less afflicted response in this 21st century. So we recommend living an alkalinizing lifestyle using personalized antioxidant nutrients that are key. Nature, nurture, and wholeness are key to using physiology before pharmacology, which I recommend. So thank you for your interest. And if we have any time, I would be happy to address any questions that you might have.
We have a few minutes.
Any questions? I think people are being polite because that, from my point of view, we tried to put a lot of information into a short period of time to remind folks to come back, look at the review chapters and articles that we make available online, look at the Joy of Living, the Alkaline Way Guide that you can download as a teaching tool for yourself and for clients. And I've said this a couple of times, but I do want to emphasize that the 21st century is a dramatically different time than the 20th or the 19th century. And the literature that you read in most textbooks goes back to the 20th or 19th century, which is the best folks can do, but it's not good enough to live well, long, and happy in the 21st century. And some of you know that I'm planning to be dancing at 120 and want my friends around at that time, because why would you want to dance alone?
And we have a request from one of the students. Is it possible to get a copy of your PowerPoint slides?
Yes, anyone who emails me will be happy to get you a PDF of the slides happily, and some other background material, that reinforces and hopefully would be of interest.
And speaking of contact, can you please give us your email over the line so that we can touch bases with you, your email and any other contact information?
Yes, it's my initial and last name, R-J-A-F-F-E, at perk, P-E-R-Q-U-E.com, or rjaffe at ElisaAct, ELISAACT.com, or rjaffe at drrusselljaffe.com, and the YouTube channel that has now about 100 short or long videos on various topics that may be of interest to the community.
All right, everybody, just make sure you record or you write down those emails so that you can correspond with Dr. Jaffe and ask additional questions. And Dr. Jaffe, we are so glad that you are here. We have a question. What was that email again? Can you just say those one more time?
Sure. It's my initial and last name, RJAFFE.
Is there a dot between the R?
No. RJAFFE at PERQUE.com. RJAFFE at PERQUE.com.
Okay.
Yes, and for anyone who is interested, we do have a viral risk reduction protocol that is available to download. It has some common sense, 7 common sense suggestions and 7 necessary supplements to avoid catastrophe.